Hello everyone, my name is Sadeel Dhaher and today I'll be presenting my project, which is about culturally relevant smoking prevention for young Middle Eastern men in Paterson, New Jersey. I chose Paterson because smoking, whether it's hookah, vapes, or e-cigarettes, has become normalized among young Middle Eastern men. With many smoke shops and cultural traditions that view smoking as a social activity, there is a strong need for culturally relevant health education. In this video, I'll walk through my project by answering 15 key questions. So the first question was 3 highlights of my people-community. First, my community is Middle Eastern men ages 18 to 24 in Paterson, New Jersey. Second, smoking is culturally common and often seen as a normal way to socialize. Third, because many families maintain strong cultural traditions, this group needs health messages delivered in a culturally respectful way by trusted community members. My next question is 3 highlights of the environment. So Paterson has a population of about 156,661 people. It's a diverse city with Middle Eastern, Latin American, and South Asian communities. It also has access to public transportation and community resources that residents use daily. Next question is 3 highlights of the health issue. Many young Middle Eastern men in Paterson smoke hookah, vapes, or cigarettes. Smoking is often seen as harmless despite causing lung disease, heart issues, and addiction. Community leaders, counselors, and healthcare providers can help increase awareness and support quitting. Next is the top 3 researchers for my health issue. The 3 key researchers connected to this topic are Dr. Mohammed Kutni, Joelle D. Ramirez, and the community health worker CHW Smoking Cessation Services team. Follow-up question is their universities and institutions. So Dr. Kutni is affiliated with the University of Jordan, where he received his bachelor's, master's, and PhD in Islamic jurisprudence. Joelle D. Ramirez is affiliated with St. Peter's College, and CHW Smoking Cessation Services is connected to William Paterson University. Next up is how my interventions show cultural humility. My intervention shows cultural humility by respecting Middle Eastern traditions and family influence. Instead of judging cultural norms, it works with the community's values to build trust and support healthier choices. Next is 3 ways the intervention benefits the community. So it lowers smoking rates and reduces risks of lung and heart disease. It uses cultural and family values to connect with young men, and it supports long-term healthy habits through education and community engagement. Next is research supporting the intervention. So research shows that culturally tailored programs are more effective for all communities in general, including Middle Eastern young adults, helping them reduce smoking and stay committed to quitting. For marketing the intervention, to reach participants, I would advertise the program in mosques and community centers, and to retain them, I would offer incentives like gift cards, transportation vouchers, and snacks. For appropriate evaluation process, this program would be evaluated using surveys and follow-up check-ins to track changes in smoking habits and gather feedback on their experience. For appropriate upstream approach, an appropriate upstream approach would be to educate young teens and families early, promoting smoke-free habits before smoking begins. One thing I would do differently is I would start the program earlier and target those younger teens to prevent smoking before it starts, since my intervention focuses on young adults who have already started smoking. Do I feel like an expert? Why or why not? I don't feel like an expert yet. Although I have learned a lot through research, I think that being an expert comes from years of training and professional experience. How I executed my role as a health educator. As a health educator, I researched the community, identified the key health issue, and created a culturally appropriate smoking prevention intervention for young Middle Eastern men. And the last question, my intentions now that my paper is complete. I plan to use what I learned to continue building my public health knowledge and apply these insights in future courses. Thank you so much for listening.